Acute eczematous dermatitis is not a single disease entity, but it is a term that we use to denote conditions which have a very similar clinical as well as histological picture. That is, the clinical picture as well as the histological picture is very similar. So many conditions that have these similar histological and clinical picture are clubbed together. So clinically, if you take a person having this condition, their skin will have initially an erythema. And erythema means that is a reddish area will be there, and on top of that reddish area or erythema, they'll have tiny vesicles, and in time this vesicles will burst up and a crust of this fluid will form here. And if it is chronic or if it is long term and that person keeps on scratching and all that, itching, because there will be intense itching, then there will be lichenification, there is hardening of the epidermis, the skin, that area. So this is the clinical picture. Now if you look at the histological picture, I'll just draw a schematic view of the skin. So suppose this is the epidermis, this is the epidermis, this is the upper dermis, this is the lower dermis. So this is lower dermis. So in the epidermis we'll have keratinocytes, right? Everything is very much close together, so I'm not going to draw the whole thing, but the thing is, the most important or characteristic histological finding is that the space between these keratinocytes will increase because of the fluid collection. That is, there will be space formation, and this is called spongiosis. And sometimes the space forming can be so huge that there will be small vesicles in between them, right? The cells, keratinocytes, will have in between them fluid filled cavities. So this is called spongiosis. So spongiosis is the most characteristic feature histologically in acute eczematous dermatitis. And acute eczematous dermatitis in fact is called spongiotic dermatitis in a pathological perspective, or in pathology means clinically they call it acute eczematous dermatitis, pathologists call it spongiotic dermatitis. So this is basically a type 4 hypersensitivity reaction, and the reasons, the etiology can be either due to endogenous antigens or exogenous antigens. Endogenous antigens, if it is due to endogenous antigens, it's called atopy or atopic dermatitis. And an example for exogenous is allergic contact dermatitis. So allergic contact dermatitis is an example for exogenous antigens, and atopic dermatitis is an example for acute eczematous dermatitis, which is due to endogenous antigens. So this is in very short or brief form what is acute eczematous dermatitis.